After completing her bachelor's degree in pharmacy at the Kwame Nkrumah University of Science and Technology, she fell in love with the processes drugs go through before they are made available for consumption. Mariam then took up the field of pharmaceutics, a branch of pharmacy concerned with the formulation and quality analysis of drugs to help her fulfill that desire. She completed both her master's and doctorate degrees in pharmaceutics at KNUST.
Because it is reported that sub-Saharan African region, we spend about 70 to 90% of the budget, the national budget, to import drugs as raw materials or as finished products. And this is seriously affecting us in terms of good health and well-being. And so that is one area that my research focuses on, to use naturally available or locally available natural polymers as excipients, and so far so good, it's working, and we are at various stages of development. The other aspects that we are into is quality control. Now there are a lot of substandard and counterfeit or fake medications in the system, and I know the regulatory agencies do a lot of post-market surveillance to check the quality of drugs in on the market. However, it's not enough. So one of the key things that we do is that we try our best to do this post-market surveillance. We pick samples of drugs from pharmacies, from over-the-counter medicine seller shops, and test them to make sure that they are up to standard.
One of the earliest works, which was published in the 2012 edition of Asian Journal of Pharmaceutical and Clinical Research, focused on naturally occurring gums as excipients in the pharmaceutical industry, was promising. Professor Mariam and colleagues found that adding cashew gum to paracetamol enhanced the drug's mechanical strength while not hindering how the drug is released in the body.
With the local excipients that we are looking into, so far we've done extensive work on okra pectin, and it has shown very promising results. And so the future is bright, actually. And one key thing about this research is that, you know, in Ghana, we have seasons for certain food products, so like yam and okra. And during the bumper season, we have them in abundance, and we have no way of storing any of it. And then in the lean season, there's nothing. It's all gone bad, left to rot on the farms. Now, this research area helps in preventing this post-harvest wastage. So we are not competing with the food industry, no, but the excess products, the pharmaceutical industry is now going to mop it up. So all the excess okra, all the excess yam and other food crops that have pectin that we have extracted, we are going to convert this post-harvest wastage into wealth for the farmers and for all those involved. And also, eventually, it will lead to reduction in the cost of medications.
Mariam Boakye-Gyasi is one of the youngest associate professors at the KNUST, some few years shy of 40. She's excited her feat will inspire the next generation of scientists.
I'm actually quite humbled. It's a very humbling experience. One of my main aims teaching over the past decade has not been just to impart knowledge to students in the lecture halls, but also to guide and inspire them. And what better way to do this than to show them that it can be done?